So my name is Lauren and I am one of the naturopaths here at Remedy Wellness Medicine. So thank you so much for coming out tonight. This is actually the first seminar we've done in about 2 years face-to-face. So what we will be talking about this evening is obviously the immune system, which is very relevant coming into winter. And we want to be doing as much as we can to support the immune system through food, through lifestyle and herbal medicine if we want to as well. So the immune system is probably one of my favourite topics to talk about, and also one of my favourite body systems to treat in the clinic as well. And we get a real variety here of different patients with a diverse array of immune complaints, whether it's an overactive immune system and autoimmunity, or recurring infections and a bit of a underactive immune system state. So it's always interesting. So what we'll be covering tonight is I'm going to do a bit of a broad overview of the immune system as a whole, so we get that basic understanding. I'm going to go into the naturopathic perspective of the immune system. We're going to chat about viruses, as viruses are very topical coming into winter, cold and flus. We want to be knowing how to prevent them as best as possible. We're going to also talk about how we can boost immunity through diet, lifestyle and herbal medicine. And then lastly, I'll be covering what we'll be offering for immune support consults, and also I'll go through our live blood analysis technique that we do here at the clinic. Okay, so as I mentioned, in the clinic we get a really diverse range of different immune system complaints. And here are some examples of those different complaints we may be hearing. And typically when a patient comes in, for example, with recurring infections, it's never usually just that one symptom. It's usually combined with fatigue, there could be some skin complaints, there could be allergies as well. So we need to take that holistic view and get the understanding of what's actually going on with the immune system, and why is this individual presenting with all of these different complaints that tend to link back to the immune system. So usually we've got a few different signs and symptoms, and we're then as naturopaths asking, how often are you getting sick? How long is it taking for you to recover from that illness, whether it's a cold or flu. It could also be a UTI or a different type of infection, a fungal infection as well. So it can be, you know, that vast array of different infections. And another question we often ask as well is, how much antibiotic use have you had in the past as well? So now we're going to chat about the immune system and do a bit of a broad, bit of a introduction to how the immune system works. So the immune system is made up of these complex tissues, organs, our white blood cells, different chemical messengers, or what you may have heard as cytokines, and also of course our gut bacteria as well. So we need to also consider what's going on in our gut when it comes to the immune system, and we'll get into that in a bit more depth a little bit later on. So all of these cells and organs and tissues are crucial for protecting us from these different infections and foreign invaders. So really important that we're supporting the function of the immune system. And when we're talking about the immune system, we also need to talk about the lymphatic system. And the lymphatic system is often forgotten about, but it's a really important part of the immune system. And I'll show you a picture here. So here we've got some of our immune and lymphatic system organs and tissues in the body. And here we can see down the bottom, we've got these lymphatic vessels which are running through the entire body. And where we need to think about how important the lymphatic system is it's actually twice as large as our circulatory system. And if our lymphatic system was to stop working, we actually wouldn't survive more than 24 to 48 hours. That's how crucial it is for the body. So really important that we're supporting that lymphatic system as well. It is moving waste around the body, it's filtering any pathogens from the immune system, and it's also providing the immune system with those white blood cells on top of that too. So how we can support the lymphatic system, if we compare it again to the circulatory system, the circulatory system has the heart as a pump, whereas the lymphatic system doesn't have that pump. So we need to be having regular movement and doing your dry body brushing and your cold showers, and that's really going to support that lymphatic flow throughout the body. Okay, so we have our innate and our adaptive immunity. So this is a bit of a broad overview, and it's really important that we remember we have on the right hand side the first line of defense. And this is where we're going to have any type of pathogen getting exposed to our body at that first line of defense. So we're thinking about the skin, we're thinking about the eyes and our tears. We're also thinking about the lungs and our mucous membranes as well in the upper respiratory tract. So supporting this first line defense mechanism through hand washing and so forth is also crucial. We then have our second line defense, and this is where we have our specific cells within the body, which are a part of the immune system, and we've got our non-specific and our specific immune system cells. So where we have our non-specific up the top here, we've got some of our white blood cells, which some of you may be familiar with. We've got your neutrophils, your basophils, your eosinophils, and these are non-specific. So they are targeting any type of pathogen or foreign object that's coming into contact with the body, and through a process of phagocytosis, consuming the pathogen, they are going to rid of that pathogen from the body. We then have our specific immunity, and this is where the body starts to kind of keep a record of different pathogens or allergens or antigens in the body, and next time we're exposed, the body remembers, and then we alert that immune response with these specific white blood cells. Okay, so we can't not talk about the gut when it comes to the immune system, because it is absolutely crucial. And Hippocrates once said, all disease begins in the gut. So here I've outlined 3 of our key factors as to how the gut and the immune system are intertwined, which is really crucial to remember. So first and foremost, we've got that mucosal gut lining, which acts as, in a way, a physical barrier, or what I've referred to here as an internal barrier. And when we think about it, we're consuming food, we're drinking water, we're breathing in air, and a lot of any pathogens in food or water may come into contact with the gut. So we need that to be a barrier between our internal organs and where that food and water is. It's that physical barrier. We also have our stomach acid, and our stomach acid is really important at killing and weakening any pathogens in the body as well. On top of that, our stomach acid is also supporting the breakdown of our food. So making sure we're supporting our stomach acidity is also going to allow us to break down our food properly and absorb our essential nutrients that we also need for the immune system as well. And lastly, we also need to talk about our gut flora, because our gut is home to trillions of different microbes, and they have such an influential role in our health. And research is coming out thick and fast about the gut microbiome. And what we're learning is that our beneficial flora has a protective mechanism in the gut. So it's protecting us, and it's also acting in a tagging process and tagging any potential threats and allowing the immune system to be told if there is a threat and alerting an immune response. So the gut flora has lots of different roles, and on top of that, they're also potent anti-inflammatory agents as well. So really important that we're supporting the health of our gut flora. Lastly, I've also mentioned here leaky gut, which is a bit of a buzzword at the moment, if any of you have heard of leaky gut. And leaky gut can refer to intestinal hyperpermeability. And with intestinal hyperpermeability, it means that the tight junctions within our gut lining are not as tight as what we would want them to be. So when they become leaky, we have these gaps in the mucosal lining, which allows the body to then absorb different pathogens and food particles through that mucosal lining into the bloodstream. And where this becomes an issue is the body is recognizing these foreign particles, whether it's food or an allergen or a pathogen, in the blood, and it's creating an immune response and inflammation. And a lot of research is finding now the link between this hyperpermeability and autoimmune conditions as well. So if we're in that hyperactive immune state, we need to think about what's going on in the gut, and is that hyperpermeability or leaky gut a part of the problem that's contributing to the overactive immune system. So in terms of leaky gut, what can trigger this, unfortunately, is stress, alcohol, your antibiotic use, and different prescription medications as well. So we need to take that holistic perspective and think about what is the contributing factors to where you are in your health journey. Okay, so here we've got an image of an example of your normal gut compared to what we refer to as leaky gut, or that intestinal hyperpermeability. And on the right hand side, we can see there that those tight junctions in the mucosal lining are actually what we refer to as leaky, and pathogens and food particles are getting into the bloodstream. So this is an example of where we're going to have an overactive immune system and inflammation, unfortunately. So in terms of doing an assessment on what's going on in the gut, the Complete Microbiome Map is probably my favourite assessment tool in clinic to use. And the Microbiome Map is a functional test, and it's a stool test, which is always a lot of fun. So with your microbiome map, what we can do by doing this test is we can assess the state of the gut. And what I've pointed out here is probably the key markers in terms of our immune system, what we can get from this comprehensive test. So looking at the first one I've pointed out there, we've got your fecal secretory IgA. And your fecal secretory IgA is our gut immune barrier. And your secretory IgA is acting like a bit of a tagging process in the gut to be tagging potential allergens or pathogens or food particles and alerting the immune system to let it know if we need to have that immune response. Is that particular allergen a threat to the body, and do we need to get rid of it? So more often than not, with this fecal secretory IgA, it is typically depleted in most patients I see. And why that is because this particular marker is heavily impacted by stress. which is always or typically a part of the picture when we have these chronic immune conditions. So looking at that secretory IgA can start to give us a piece of the puzzle when we're asking why someone is getting sick all the time, and potentially also why they do have some gut infections going on as well. So the next marker here that we can see is your fecal zonulin, and your fecal zonulin is a marker for leaky gut, or that hyperpermeability I was talking about. And here we can see on this result, it is well and truly at that upper end of the range, which is telling me that we've got that inflammation going on in the gut, and there is that leaky gut presentation that we need to address. Lastly, down the bottom, we can see we've got some infections in the gut. And here, again, we need to be asking why these pathogens are present and how this individual has got to the state where these pathogens are now considered an overgrowth. So this particular individual, this is a sample, but let's say, for example, they've got all these bacterial infections and they've also got a fungal infection as well. And of course, we're all exposed to these different nasties in our environment, but it comes down to the ability of that gut immune barrier to alert the immune system to fight off the nasties. And on top of that, it also comes down to our beneficial flora as well. So our beneficial flora is also fighting off any sinister infections in the gut. So really important that we're taking that holistic view and asking why we are where we are. Yeah. So this is another part of the microbiome map, and this is where we're looking at our beneficial flora strains. So on top of seeing any potential pathogens in the gut, we can also look at what the beneficial flora is doing, and ideally we want these guys to be nice and healthy in that green in the midsection there, which is really important. We can see here that a lot of those strains are right down the end, unfortunately. And this is typically where we've had a lot of antibiotic use. There could be a lot of stress, there could be a poor diet, and we're not actually feeding our beneficial flora. But we need to address this, increase our beneficial flora, and make sure we're having a healthy diet to feed them as well so they can thrive. And in terms of our beneficial flora, what they're doing is they're supporting our immunity and our gut immunity. They're creating anti-inflammatory byproducts, which are also referred to as short-chain fatty acids. And this is potent anti-inflammatories in the gut, which is really, really crucial. And of course, they're preventing infection. So typically when we see a lot of the pathogenic overgrowth, it's often paired with low beneficial flora as well. Okay, so the naturopathic perspective of immunity. In terms of the immune system, as naturopaths, our perspective is that the body systems are influencing each other. So for example, in terms of the immune system, if we think about our hormones, if we think about our being stressed, or even when we're anxious, this all has the ability to affect our immune system and the immune system ability to then fight off infections. So for example, when we have that hormonal fluctuations as women, prior to our cycle or our bleed, we typically have that suppressed immune system coinciding with our hormonal fluctuations. And similarly with stress, when we undergo chronic stress, our immune system is also not operating at its optimal level. So when we're thinking about any type of body system, we're thinking about how other systems can influence the immune system as well. And when it comes to the immune system, we want it to be in harmony, or in, I guess, a homeostasis. We don't want it to be in this hyperactive state And we don't want it to be in this underactive state. We want it to be in a nice healthy balance so we can fight off any infections when we need to, but we're not, over producing these immune system cells, which can cause issues. So it's all about balance, really, with the immune system and with the body systems. And when we're out of balance, when we're getting recurring infections, colds and flus, or we have autoimmune conditions, what that is indicating is something is out of balance. And as naturopaths, we want to get to the reason as to why. We want to find that root cause. So diving into viruses and pathogens. A pathogen can be defined as an organism that can cause disease. And a pathogen we're thinking about could be your virus, your bacteria, a fungal infection, a parasite or a worm. And tonight we're just going to really focus on viruses, as with the cold and flu season coming up, it's quite a relevant topic to understand. So what is a virus? A virus is a microscopic organism, and it actually needs some sort of host to start to replicate. And whether that host is a human, an animal, it could even be a plant or a bacteria, it's going to invade and begin to replicate within that host. And viruses have been around for a very, very long time, and it's perfectly normal that we are exposed to these different viruses, particularly over that winter season. And I have heard before that at any one time in winter, we can actually be exposed to 5 to 10 different viruses at one time. And that's where the immune system is really ramping up and protecting us as much as possible. So it's when we're exposed to these viruses, it's an opportunity for our immune system to be challenged as well. We need to, be able to fight these viruses off effectively. So these are all pretty standard practices that we are quite used to at the moment. It's always good to remind everyone that it's important we should be washing our hands, trying not to touch our face, staying home if we're unwell. But it's crucial that we do this to prevent infecting others, and also reducing the viral load as well is really, really crucial. So one particular thing that is very effective is actually doing nasal irrigations. So when we think about being exposed to an infection, if it's a virus, if it's airborne, or if it's on our hands, the first point of contact is typically going to be our face and our upper respiratory tract. So what we then want to be doing is thinking about those first line of defense mechanisms and really trying to support the reduction of the viral load. When we're exposed to the virus, it's typically going to be in the nasal passages, in that upper respiratory tract, and then the virus is going to start to replicate. If we were to start to use nasal irrigations, really, really gentle nasal irrigations, whether it's a saline spray, a xylitol-based spray, or some sort of natural, nasal irrigation, it's going to start to reduce the viral load, and we can assist with the flushing out of that infection. It's certainly by all means not going to completely prevent the infection, but if we can reduce the viral load, that can have a big impact on how unwell we can get potentially. So what we usually recommend is nasal irrigation every evening after you've been at work, after you've been on the train or been out and about, can be really effective in reducing the severity of a cold or flu. So here are two sprays that we may recommend. One of these is a xylitol-based sinus spray, and the other one is a grapefruit seed extract. And these are natural antimicrobial sprays that you can get from the chemist. Very easy to use, and they're not going to make you rely on them either, which is good. So there's some good options to have at home. Even if you're just using a neti pot or a nasal flush with a saline spray is also great as well. Okay, so we're going to jump into how we can enhance our immunity and prevent infections. So it's really important that we consider diet, and I'll get to everyone's plant-based tracker soon. How we can enhance our immunity is through these examples. These particular foods are probably my top foods that I like to recommend to clients to really enhance that immune system. And a part of this is because they're rich in antioxidants. We've got foods here that are plant-based fibers, which we know feed our gut microbes, and our gut microbes support our immune system. So the more we can feed the gut, the stronger the immune system. We've also got some garlic, some ginger, your apple cider vinegar, and your bone broth. And these particular foods are fantastic for our gut health, the mucosal lining, and also supporting that stomach acidity to kill off any pathogens. So everyone's got a plant-based food tracker. So what I would like to challenge you all to is spend a week filling out this tracker, assessing how many plant-based foods you're getting in the diet. And the goal here is to get 40 plus, which is a real challenge. And it's a good reminder that we need to keep increasing the plant-based foods in the diet. So what it has on the top is it's focusing on different colors. So really trying to get all of those beautiful colors in the diet and rotating your different fruits and veggies as much as possible. So if you're someone who always loves to have your broccoli, try and swap that for a different vegetable, such as your cauliflower, and keep trying to rotate all of these different foods as much as possible, because we know that these different plant-based fibers feed different gut microbes. So if we're always having the broccoli, we're going to continue to feed the gut microbes that feed off the broccoli. So that diversity is feeding that gut microbiome, which is really essential. So I challenge you all to spend the next week filling this out, get an understanding of how diverse the diet is, and then challenge yourself to get more colors in, get more variety. And this isn't just your fruits and veggies. We're also thinking your nuts, your seeds, your herbs and spices, your legumes. So really building that immune system in the gut is crucial. Cool. Okay, so continuing on with how we can enhance our immunity, probiotics are also a fantastic way to support our gut and our immunity as well. So there was one study that I'll refer to that had children taking a combination probiotic every day over winter. It was a combination of a lactobacillus and a bifidobacterium probiotic. And there was a significant reduction in colds and flus in that group of kids. So when it comes to probiotics, they're very popular at the moment, and they're available absolutely everywhere as well. So we want to be really specific about what probiotics we're using, and also ensuring that we're getting a good quality. And it's not always about the highest amount of the probiotic within that capsule. It's about the strain and being strain specific and the quality of the probiotic. So in terms of probiotics, I'm typically being strain specific based on somebody's gut microbiome results or a particular health concern they have, because of the evidence that that particular strain has for that sign or symptom. So for example, a patient presenting with eczema, we want to be strain specific, and we may use a particular strain of lactobacillus to support that patient overcome that infection or what's going on with the eczema. And research is finding that we also need to consider the ability of these probiotics to actually stay in the gut as well. And depending on which probiotics we're using, some may not actually be staying in the gut. Some may be staying in the gut for a short period of time and helping with that particular condition, but not necessarily colonizing. So that's where it's really essential that we're using probiotics in a certain manner that is prescribed by a practitioner, really. So you know that you're getting your bang for buck. Yeah. So in terms of using your probiotics, we know that more than 80% of our immune system cells are in the gut. So we need to think about the microbiome, repopulating that microbiome with those strain-specific probiotics, and then making sure we're feeding the gut microbiome with our plant-based diversity. Okay, vitamin D. So this is probably one of the most common deficiencies I see in clinic. And as I've mentioned here, 1 in 4 Australians have a vitamin D deficiency. And vitamin D is really important. It's important for our calcium absorption, it's important for our bone health, our mood, our cognition, our immune system, and also our reproductive organs. So really crucial that we're in a good state when it comes to our vitamin D. And a lot of people really struggle to convert vitamin D through the skin, and genetically really struggle for that vitamin D to be activated, and that's why so many people are deficient. So what we're aiming for in clinic is we're aiming for levels to be above 100. And that's where we want to be making sure, particularly individuals that are presenting with these recurring infections, with any skin conditions or autoimmune conditions, that their vitamin D is at a nice healthy level. So really crucial that we're testing here, and then we're dosing based on where the levels are at. Your vitamin C and your zinc is also one of my top favourites to be used for any infections. And your vitamin C is a potent antioxidant and really effective at clearing any infections. In terms of getting enough vitamin C, if we were to compare, say, having an orange in comparison to a vitamin C supplement, they're going to vary greatly in how much vitamin C we're actually getting. So for example, the orange would probably have around 60 to 70 milligrams of vitamin C in comparison to a supplement that we're probably looking at 1,000 milligrams a day. So to get that high level, we're not going to be able to always get it through food. And that's where we do need to sometimes supplement and be really specific about good quality supplements, so we're getting the best form as well. So vitamin C, we typically want to separate the dosages. So we may look at doing a 500 milligram in the morning and 500 milligram in the evening, separating those dosages and going high dose whilst we're unwell to really help clear that infection and any excess oxidative stress that's been put on the body from the infection as well. So zinc is probably one of my favorite minerals, and it's essential, of course, for our immune system and our white blood cell production. It's really important for wound healing as well, and the production of our stomach acidity. So we need zinc to produce that hydrochloric acid in the stomach. So zinc, it's fantastic for immunity, as I mentioned, but also a great mineral for our skin health and our gut health as well. So it's a bit of an all-rounder. So in terms of zinc, we've got our zinc-rich foods here, which we can ensure we're getting in the diet as much as possible. I do also like to test zinc. And how I test zinc could be through blood testing, it could be through a hair tissue sample, or it could even be through a zinc tally taste test, which we do here in the clinic to determine if there is a zinc deficiency. In terms of supplementing, I'm usually going quite high dose when there's a severe deficiency, and that's looking at least 30 milligrams a day for a zinc supplement. And we always want to be having zinc with food because it can upset our stomach sometimes and cause a bit of nausea. Okay, medicinal mushrooms. So mushrooms are fantastic for enhancing and regulating our immune system. We do actually have some in the retail section, which are very popular, and patients have been saying that they've been getting a lot of benefits from them, whether it's helping them with cognition or mood or the immune system. And there's a lot of research coming out about mushrooms and how fantastic they are for the immune system. I particularly use them for chronic immune infections where people are in quite a debilitated fatigue state. And the reason I like to use mushrooms is because they're supporting the immune system, but they're also working as what's called an adaptogen. And in terms of adaptogens, that's where we're getting support for the stress response. So it's helping patients with that stress response and also to overcome these chronic immune conditions as well. Quercetin is another option that I like to use in the clinic, and this one's pretty popular at the moment, particularly with allergies. So it's a fantastic anti-inflammatory, and it's also a really good natural antihistamine. So if any of you have allergies, it's a really great option to support that allergic pathway and down regulate our histamine response. In terms of food, we're looking at your apples, your onions, your asparagus, your broccoli and your kale. They're really rich in that quercetin, which is really great. On top of its immune abilities, it's also good for the gut as well, and reducing any viral infections in the body. So it's a really nice option. Okay, so we've spoken a lot about foods to increase, but we also need to be considering pro-inflammatory foods in the diet, both as prevention and whilst we're unwell. So these all probably don't come as a surprise to anyone. And this is about reducing the stress on the body and reducing any additional inflammation. And it's really important that we're resting during this time and we're not putting any more stress on the body. So of course we're really trying to reduce the alcohol, reduce caffeine, your red meat, your dairy. So dairy can be quite mucus producing, particularly when we've got a cold or flu. It can really enhance the mucus production in the upper respiratory tract. And also reducing any wheat-based foods, and on top of that, any of your artificial colours and additives in the diet as well is really crucial. Okay, so we're going to jump into looking at some of my favourite herbs for the immune system now. And your andrographis is probably one of the best herbs to use for an acute infection. So cold or flu is really crucial here, that we're using your andrographis at a nice high dose. And it's a really great herb because it's antiviral and it's antibacterial. And with this particular herb, it's more so to be used for an acute infection rather than a long-term infection. So in terms of supplements here, most of you have probably heard of the bioceuticals, your Armour Force, which a lot of people use, which is great, but it's not to be used long-term. So that's where we want to be cautious and be making sure we're going off the prescription on any supplements, because supplements like your angiographies are for that acute infection when we're first exposed to the bacterial or viral infection, but really, really potent with how it can help with recovering from an illness. Your echinacea is also another herb that most people have heard of, and as well as being a very pretty herb, it's fantastic because it's an anti-inflammatory, it's antimicrobial, it's also a lymphatic. So it's supporting that lymphatic drainage through the body. And on top of being used for any type of infection, whether it's acute or chronic, I'm often also using echinacea for any skin complaints as well, because it's a great lymphatic. So it's getting that lymphatic system moving and reducing waste from the body as well. Here we've got your elderberry, which is great for any excess mucus production. And your elderberry is typically used in kids and often used in the product Sambucol, really, really effective at reducing the viral load and getting that mucus out for little kiddies. And of course, we are also going to mention turmeric. So your curcumin is the active component in our turmeric, and turmeric is a fantastic anti-inflammatory herb. Of course, we might be using turmeric in our cooking, a turmeric latte, but in terms of getting a high dose of a turmeric herb, we need to be getting it at a therapeutic dose that's prescribed by a practitioner. So it's actually going to have those anti-inflammatory impacts. So where we would consider your turmeric is where we've got that fatigue, those flu-like symptoms where we're really achy and sore, we might have some headaches, and we just feel generally inflamed. It's going to be really, really effective there for those nasty flus. Okay, so jumping into lifestyle support, of course we need to think about stress. And as some of you may know, persistent or long-term stress has an immune suppressant action on the immune system. So we need to be doing these stress management techniques as much as possible. And this is something I often have to talk about with most of my clients, because stress is so underestimated, and we need to make sure that we're training the nervous system to be in this calm state. We also need to be getting at least 8 hours of sleep. So we know research has showed us that if we have reduced sleep, it's going to impact our immune system and a lot of our other systems as well. Regular exercise, of course. Cold showers are fantastic for stimulating our lymphatic flow, and doing some grounding practices as well. So grounding is quite an interesting practice. I'm not sure if any of you have heard about it before. And it's where you are actually planting your feet on the earth and spending more time in nature with direct contact to the earth. And there's actually a lot of research that's already around and coming out about the anti-inflammatory impacts that grounding has been shown to have, which is really, really fascinating and has been shown to support the immune system as well. Okay, so I'm going to have a bit of a chat about our HemoView, which is our live blood analysis technique that we use here in the clinic. And what we're doing with the HemoView is we're looking at your health at the cellular level. So we're looking at a blood sample under the microscope, and we're actually looking at this sample with you when we do the test. So it's a really fantastic test, and we get an assessment of what your immune system is up to, because we can actually see the different immune system cells in the sample. And we're also looking at any inflammatory markers, we're looking for any oxidative stress, we're looking for any liver stress, and also any gut inflammation as well. So by doing this test, we get a really good picture of your health, and that can be a fantastic measurement tool to use in clinic with you. So for example, I'll run through a few of the different immune markers that we might look at under the microscope. These guys over here are our neutrophils. These are perfectly normal for us to see through the sample. And your neutrophils are, I guess, the garbage collectors of the immune system. So they're moving through the blood and they're looking for anything that shouldn't be there and doing that phagocytosis, or that engulfing process. So really crucial that these cells are working properly. And within the heme of you, we're assessing and doing a count of all of your different immune system cells to determine the different percentages and what your immune system is up to. We're also looking at your lymphocytes. So this guy here is a swollen lymphocyte because he's got that band around him. And this is what I like to, this is what is referred to as an atypical lymphocyte. And when we have these atypical lymphocytes, it can actually indicate we're fighting off an infection, which is typically viral when it's a lymphocyte. Here we have a monocyte, this guy up here, and your monocytes are non-specific, but we may see an increase in these monocytes during an acute infection. Where we've got these white blood cells sticking together, this is where the immune system is really ramping up and fighting off some sort of infection or toxicity in the blood. So if we're seeing that cohesion under the microscope, usually there's been that exposure to something, whether it's a toxin, an allergen, or a pathogen. We're also looking at any inflammatory markers as well under the microscope. So the top left-hand side is an indicator of what we call erythrocyte aggregation, or a little bit of stickiness in the blood. And this can indicate that there is some sort of inflammation process or pathway happening in the body. We've also got some fibrin clusters on the top right hand corner and some fibrin raindrops down the left hand side, and this is where we actually have some liver stress going on. So we know that in terms of our blood testing, looking at liver markers, that's going to pick up if there is any liver damage. But what we can see under the heme view is if the liver is under stress. So it's fantastic to be able to compare both of those assessment tools and get an understanding of where the liver is. And down the bottom is what we refer to as rouleau, and this is where we've typically got a real inflammatory pathway being activated in the body, and your red blood cells are really overlapping. So we need to get to the bottom of why this is happening and understand where that inflammation is coming from. Okay, so last but not least, we will be offering consultations that are immune system specific to support patients in the upcoming months. So this will be available for a short time only while we're prepping for winter. And following on from these 40-minute consultations, we'll be offering 20-minute follow-up consults to check in and make sure that we're achieving the goals that we've set out in that initial consultation. We do also have our online booking system working, so you can jump online and you can make your bookings without needing to call, which is always a great option. And in terms of these consults, they will also include tailored lifestyle and dietary plans as well, which is always good to have that plan to follow. Great, alrighty. Thanks so much for coming, guys. It's been a pleasure. And have a good evening. Thank you.